I never wondered why the windows in my ward had bars on the inside instead of the outside. Whenever I asked the nurses, they smiled and told me the building used to be an old asylum and removing the bars would cost too much. They said it so often that I eventually stopped asking. When the hospital finally closed, there were only 8 patients left, including me. We were told we would be transferred to another hospital soon, but nobody ever came. Every morning, another staff member failed to arrive. First, the cleaners disappeared, then the kitchen workers, then the guards, until there was only one nurse and one doctor left. They kept telling us help was on the way. They said the phone still worked and everything was under control. I believed them because accepting the truth was far more frightening than believing their lies. Staff disappeared. The hospital became unnaturally quiet. I had lived there long enough to know every sound. I knew which radiator clicked at night and which floor tile creaked outside the dining room, but now new sounds had taken their place. Every evening, at exactly the same time, I heard footsteps walking down the hallway. They never stopped outside any room and never rushed. They simply walked from one end of the ward to the other before fading away. At first, I thought it was the doctor making his rounds, but one night I clearly heard him snoring inside his office while the footsteps continued outside. Other patients noticed strange things as well. One claimed someone was taking tiny bites from the bars of soap in the bathrooms. Another insisted the ceiling lights blinked in the same pattern every hour. I dismissed their stories because people in psychiatric hospitals often imagined things. Then one afternoon I looked around the dining room and realized every chair had been turned slightly toward the entrance. None of us admitted moving them. Even the nurse looked confused when she noticed. Without saying a word, she quietly turned every chair back into place. After that, the days became impossible to track. Parts of the building lost electricity, and entire hallways disappeared into darkness. The doctor stopped shaving and avoided looking anyone in the eye. Whenever I asked when we were leaving, he answered too quickly, as if he had repeated the same sentence 100 times before. One evening, I walked past the reception desk and noticed every phone cable had been carefully removed. Nothing had been cut. Someone had simply disconnected them, so they still looked functional from a distance. I barely slept anymore because every night I dreamed someone stood beside my bed, counting in a soft voice. Whenever I woke, the room was empty, yet my blanket was always tucked around me more neatly than I remembered. One morning, the corners were folded perfectly. I asked the nurse if she had done it. She stared at me for several seconds before quietly asking if I had left my room after midnight. When I said no, she nodded once and walked away without answering. Then a strange smell spread through the hospital. It did not smell like decay or mold. It smelled like wet paper sealed inside plastic for years. The odor drifted through empty hallways and seemed strongest near the abandoned part of the building. Curiosity finally overcame my fear, so I followed it downstairs into the old asylum wing. The walls were covered with peeling paint and old patient files were scattered across the floor. Every file contained a photograph. Every face had been scratched away except for the eyes. The eyes remained untouched, staring back at me through the damaged paper. Then I heard someone clear their throat behind me. I turned, expecting to see the doctor. Instead, I found an old wheelchair facing the opposite direction. It had not been there only moments earlier. I tried convincing myself I had simply missed it. Then I noticed fresh wheel tracks in the dust leading toward me. There were no tracks leading away. I backed into the hallway and hurried upstairs without looking behind me because I no longer trusted what my eyes were showing me. That night, every door on the ward clicked open at the exact same moment. None of us stepped outside. We stayed in bed listening in complete silence. After several long minutes, the footsteps returned. This time they moved much slower. They paused outside every doorway. When they reached my room, they stopped completely. I stared through the narrow gap, expecting to see a face. Instead, I saw only the shadow of bare feet, standing perfectly still. The silence lasted so long my heartbeat became painful. Eventually, the footsteps continued down the hallway, but even though I could only hear one pair of feet, I could hear breathing coming from several different heights. The next morning, the doctor was gone. His office was perfectly tidy. His coat still hung on the chair, and his watch rested beside a cup of tea that was somehow still warm. Nobody searched for him, because nobody wanted to walk through the hospital alone anymore. By sunset, only one nurse and I remained. She placed a ring of keys into my shaking hands and whispered that every patient eventually reached the same conclusion. Then she walked into the old West Wing, locked the door behind herself, and I never saw her again. 4 days later, rescue workers finally entered the hospital. They found me sitting alone in the dining room with every chair facing the entrance. I tried to explain that I had turned them because whatever walked the halls every night became angry whenever they faced another direction. Nobody believed me. They insisted that I had been alone in the building ever since the staff disappeared.